Hi everybody, welcome to Vijay Foundation. My name is Manoj Swaminathan and today we are going to learn about a very important topic and that is about medical literature monitoring in pharmacovigilance. So this is primarily about the literature search and review. So first let me talk to you about the literature case reports, right? And also the flow that how this gets identified and how this gets processed or even say published. So we'll talk about that in detail. Assume this small girl or a young girl taking a medicine for her cough. Okay, so she's been given a cough syrup, and okay, let's assume that it's a new cough syrup. Okay, so she has taken this cough syrup, and within few minutes she develops blue rash on her arm. Now rashes are generally red color, right? And now she has developed blue rash. Now her mother takes her to the physician who prescribed the cough syrup. The physician finds it interesting. So the physician asks for the consent and takes the photograph of the uh, blue rash because he has not seen such a case any time in the past. Okay, and also it is not expected with this medicine. Now the physician feels that this is something very interesting and we should consider publishing it. Now the physician has found this interesting, okay, and he is very convinced that it is a drug induced side effect because it happened 15 minutes after taking the cough syrup. So now what will the physician do? So physician has two choices to evaluate whether this is already known, yes or no. As I told you, this is something which is unexpected, okay, and the physician also is seeing this for the first time. Now, if it had been already known, then the physician would evaluate whether it is there is anything unusual with this case report. Okay, not only physician, it can even be another any other healthcare professional. But then, for convenience, I'm talking about a physician. So, is there anything unusual with this case? Yes or no? If there is nothing unusual, then one can ignore this. However, if there is something interesting or unusual, or else if this was not already known, what would the physician do? Is to gather additional information, and this is what he or she did, wherein the physician took the photograph, right? Took the consent from the parent and took the photograph of the rash, and also uh, would capture the relevant data. Like he would already know about the history of the patient, right? And in this process, there will be some more physicians or say healthcare professionals, even the pharmacists who would be more interested in this case, and they all will come together, and they are going to be the future co-authors, and they prepare a manuscript. Okay, now once they prepare the manuscript, they would submit it to a journal. Okay, because they want to get it published. They want the entire medical fraternity to know about this case report. Now once it is submitted to the journal, the people who belong to the journal, right, the people who review the articles which are submitted, so they would review and update the article. They will also evaluate whether this really makes sense, right? Also verify the authenticity. Now it is also possible that there is an upcoming conference and the authors feel that we should also submit this abstract to the conference. You never know if it gets selected. Now finally the case report gets published, right? So even when you talk about conference abstracts, even they also get published, and when you submit a fresh article to a journal, even that can get published. So now what has happened? Ultimately the case report, right, a young girl with blue rash, and it is now published in a relevant or specific journal, and the whole world or the medical fraternity is aware of this case report. So this is typically how the literature case report is identified and published and then known to the pharmaceutical companies. Okay, And this is, as you see here, it's a continuous circle, right? I would say a chain, right? So this rigmarole will keep on continuing, and it is possible that the healthcare professional comes across another interesting case, and they would follow the same sequence and get it published. And then we would also come across such drug-induced adverse events. So what data is screened when we talk about literature monitoring? So the previous example was a typical drug-induced case report, right? So a drug-induced adverse event, right? So it's a case report. So most common are the case reports. You can also get safety articles. So these are about, these can even be, say, a retrospective review, right? So that's a possibility, or meta-analysis and so on. And at times even it can be clinical studies where you identify the safety parameters. Then you may even get information about the efficacy data, right? So even that is relevant from the pharmacovigilance point of view. Then finally, the unexpected therapeutic benefit. At times, you have a drug which is approved for something, and you come across interesting side effects, and then one fine day the side effect becomes the indication, right? A classic example of, say, minoxidil, right? So this medicine was being used for hypertension, and what was observed is the people who were bald started developing hair, right, on their scalp. So based on this, some studies were done, and it was realized that minoxidil is effective in alopecia. And today, minoxidil is primarily used for alopecia. One more example is that of Viagra, right? Sildenafil. The medicine was primarily used for pulmonary hypertension. And then what it was observed, the side effect is erection, right? And based on that, what it was found is the people with sexual dysfunction found it beneficial, right? So based on this, there were some studies done, and now the medicine is primarily approved for sexual dysfunction, right? So these are classic examples of unexpected therapeutic benefits, right? A side effect which is then useful for the uh, patients. So that is also, which is that is also an information that is screened. Uh, and recently we have seen the example of COVID, right? So where a lot of medicines have been used, right? And these were never indicated for COVID, and but then it was observed that the patients were getting benefited. So this is also a classic example of unexpected therapeutic benefit. Now, let us look at the various databases available for literature monitoring in pharmacovigilance. The most common ones I would talk about. The first and foremost is PubMed. Yes, PubMed is free of cost, right, and easily accessible. Then you have Elsevier, right? Elsevier owns Embase. So Embase is again a good database for looking for uh, relevant safety articles. Then you have Ovid, right? Or it was owned by Springer, right? Something called Reactions Weekly. So, or Reactions Pharmacovigilance Insight. Right? So this was previously owned by Springer, and now it is owned by an Indian company called Wipro. Then there is one more database which is Medline, right? So Medline is also used for literature monitoring, and there's one more called Ebisco. So this is something which I came across while I was evaluating the GVP modules, right? So that time I came across this Ebisco. So this is also one well-known database. So what does the regulation state? I'm primarily going to talk about the European regulation. What does it talk, or what does it state? Marketing authorization holders are expected to maintain awareness of possible publications through a systematic literature review of widely used reference databases. Example, Medline, Excerpta Medica, or Embase. No less frequently than once a week, right? At least once a week. Now, after going through this paragraph, you would say, I cannot find PubMed, right? I agree with you. And this is where we have this clarification. that Medline, Embase, and Accepta Medica are often used for the purpose of identifying ICSRs or the individual case safety reports. These databases have broad medical subject coverage. However, other recognized appropriate systems may also be used. So this is where you can also use Embase, PubMed, or else you can even develop something which is custom made, right? You can use all sort of artificial intelligence techniques, and you can also develop a database, right, of your own. So even that is also okay. Now let us talk about the search strings, right? So what should you search? Just the product name, or it should be something beyond that, or should it be more specific? Now, again, the European Medicines Agency has prescribed a search string, which is a very interesting and relevant one. I'll show you the same. It talks about the drug name and all sort of things. I'll read out few of things. For example, medication error, carcinogenicity, drug misuse, abuse, then withdrawal, treatment failure, lactation, right? So contraindication, even environmental exposure. So all sort of things are included in this search string. So this is the way you do it. And what you need to do, you have the product name and all this thing. You just put it in the search bar and you can get the information. So this is the way you can do it. Now, how about the case validity? The case validity concept remains the same, right? So it is all about the 4 minimum criteria, right? So if you have all the 4 minimum criteria, then the case report is valid. So here the identifiable reporter will be the author, right? Then you have the medicine, suspect drug, then the adverse event, right? And the adverse event. So all this information, and then the case becomes valid. At times you may not have information about the patient, right? Age, gender, anything, nothing. You don't have anything. So that time you can order for the full text, or you can reach out to the author and get the information. So what is the day zero here? As I told you that a company or a marketing authorization holder or the pharmaceutical company has to monitor at least once every week. The day they come across the literature article, that becomes the day zero. Okay, that becomes the day zero. So that's something you should always remember. Then product ownership. Now, whenever you come across a literature case report, you wouldn't have the brand name, right? You would only, at the most, you would know the country name, but you wouldn't have the brand name. So every company that sells that product in that country should assume that it is their product. What can be the only exception is when the formulation is different, strength is different, right? Sometimes you had the trade name or the brand name in the literature report, then yes, you can rule out. But if nothing is available, then you cannot rule out your product. So it is possible that there is a literature case report and all companies, say 10 companies selling that product in that country, all of them would need to process that case report, right? So that is a possibility. So let us look at some examples about validity, okay, and the product ownership. So let's take the first example where this is a scenario, okay. You have a company A, okay? So it's a pharmaceutical company or a marketing authorization holder, and they were incorporated in the year 2020. What does that mean? They started commercialization only after the year 2020, and they have diclofenac tablets. Mind it is diclofenac tablets, not injection, okay. They have this product commercialized in United States, Canada, Kenya, and China. Only these many countries and diclofenac tablets. Now, I will ask you a few questions and you will be able to appreciate how you can rule out the ownership. Okay. First is you get a case report of diclofenac injection from Kenya. Now, this company has only diclofenac tablets in Kenya. Okay. And you got a case report for injection. So is it valid or invalid? Quite obvious, it is invalid. Why? Because company doesn't have diclofenac injection anywhere in the world. David Kenya. Okay. Then next example, diclofenac tablet case report from India. Now the company has diclofenac tablets. Okay, but then in which countries? US, Canada, Kenya, and China. Now, if you get a case report from India, would you process it? The answer is no. Right? So it is not valid. Right? So this is the way you rule out the validity. One more example. The company gets a case report, diclofenac tablet case report from the United States. Now, this article was published in the year 2018. As I told you, the company was incorporated in 2020 and they initiated the commercialization after 2020. So it is quite obvious that an article which was published in 2018 may not pertain to the company's product. Right? So what do you do? Again, you rule out, right? So this case report becomes invalid, right? So this is the way you need to do the literature monitoring. Now, you also have something called as local literature monitoring, and I have used the term local. Absolutely no spelling mistake. I intentionally have used this term local. This is because you need to do global literature search, yes, because you might sell the products in all countries, but you also need to do local literature monitoring because there may be some articles that are published in journals which are not indexed, right? Or not on PubMed, Embase, Medline, or anything, or even Abisco. So these are literature journals, right? Or say scientific journals are local to that country, and assume that these are published in local language and also in hard copies and given to the medical fraternity in that country. So in that case, these valid literature case reports may not be available on PubMed, Embase, or any other such literature search databases, right? So this is where the regulations state that a company should evaluate or look for articles in these countries or these journals. So I'll read out what does the regulation state. Marketing authorization holders should have procedures in place to monitor scientific and medical publications in local journals in countries where medicinal products have a marketing authorization and to bring them to the attention of the company safety department as appropriate. So this is very important. So it's not that okay, you are doing a PubMed search, that is enough, or you are doing a Embase search and that is enough. No, nothing may be enough, and hence you need to look at local journals as well. Right? Otherwise, you may miss out on important case reports, right, from the countries where you are commercializing the product. Now, translation requirements. Many times, the journals are published in the local language, and even the abstracts may be in local language, so that may be a problem. If the abstracts are published on PubMed or Embase, then it's okay. You will be able to get the English version. But if these are always published in local languages, then it may be a problem, right? Now you come across a literature abstract and you could do some kind of a Google Translate or something, or you came to know that, okay, this is my product. Okay, let's take an hypothetical example that you got a literature article from Japan. Okay, the article is in Japanese, but you have your products in Japan. So you understood from the English abstract that the product is yours, right? But then you don't have much information. You don't know the adverse event, but then you have the details of the author and so on. So what do? You send it for translation. At the same time, if you get all the 4 minimum criteria available in the abstract, then that becomes the day zero and you process the case report with minimal information. Now you'd still send it for translation. Now you got the full text translated and you have got all the information. Now, if in case you had the abstract without the 4 minimum criteria, then you would wait for the article to be translated. And the day you come across the 4 minimum criteria, that becomes the day zero. Okay. So please remember that. So even if on 1st of January you come across an abstract in Japanese language, and you also have the literature case report in Japanese language, so you sent it for translation on the same day. On 6th of January, you got the English translated article, and you came across the product name and the say the formulation and everything. It matches with that of your company. So 6th January becomes the day zero, because that is the day when you have the information about the 4 minimum criteria. So this is the way you need to evaluate. Then abstract versus full text. So abstract may not have all the information, right? So it's always recommended that you order for the full text. So whenever you have the abstract, okay, you have the 4 minimum criteria, you go ahead and process it, and you request for the full text article. Then if it is a expedited 15-day report, then you can incorporate that as a follow-up and you can process it. So this is the way it will work. Sometimes abstract doesn't have information about the 4th minimum criteria. For example, you don't have the information about the patient in the abstract, so you again request for the full text, and in the full text you got the information about the patient. So that becomes the day zero. So this is the way you need to find out or evaluate literature articles. Now reporting requirements. So it is the same, because these are considered spontaneous again, or say non-solicited. The reporting reports requirements remain the same. That you may need to report serious unexpected cases within 15 calendar days. If it is Europe, then all global foreign global cases which are serious need to be reported in 15 calendar days, and so on. So the reporting requirements continue to remain the same based on the seriousness and also the expectedness, right? Now, when should you start literature monitoring? Assume that on say 1st of Jan, you submitted the dossier for the product license, okay, and you expect the approval in 2 years, and only then you will start commercialization, right? For obvious reasons. So ideal scenario, whenever you submit a product dossier, right, for license approval, from that day you should start monitoring the literature articles. I wouldn't say that you should submit those case reports. You just need to monitor for safety reasons. You never know what is going to happen in these 2 years. The product may get banned in some countries, right? Or the product, you may come across new side effects, right? Or you get new safety information, right? So all these things can happen in these 2 years. So you should continuously monitor the safety data, okay? And if you get literature case reports in these 2 years, you don't need to submit them, you don't need to process them, but at least you should have some kind of tracker so that you can have that awareness, right? So you may come across something very unusual side effects, so even that has to be documented. And at times you may need to update your product label while the approval process is going on, so that is also a possibility. So I would repeat, when should you start literature monitoring? The day you submit the product dossier or the ANDA application or the NDA application. From that day, you should start the literature monitoring. Okay, please remember this. Now, as I told you, literature monitoring has to be done by the pharmaceutical companies. Okay, but then is it possible that the regulatory agencies themselves undertake literature searches? That too on behalf of the marketing authorization holders. Is that possible? Right? You might be wondering, there is so much of duplication. All the companies having the product are submitting. So is there a way that the regulatory agency can do something? So this was something tried and tested, where you have the concept of medical literature monitoring, and this was initiated by the European Medicines Agency, and they undertake the literature monitoring for some, I think it is around 200 products, and they share the case reports to the pharmaceutical companies or the marketing authorization holders. So I'll show you how this concept works. But then before that, let's evaluate why this was done. Now, this product, diclofenac, is commercialized by so many companies or the marketing authorization holders A, B, C, D, E, F, G, right? So many companies are commercializing the product. Now, all of them come across serious adverse events. What they will do, they will forward all of these case reports to, or the same case report to the European Medicines Agency. Now, what will happen? There will be duplication, right? All companies have done a lot of hard work and they have reported the case report to the European Medicines Agency. Now, what if there had been only one, say, service provider for all these companies and only they would process the case? It would have been so efficient, right? And lot of time saving for all these companies. So this is what European Medicines Agency thought that we should also evaluate. And what was the outcome? That they would start evaluating the literature case reports, okay, and on a periodic basis. And the moment they come across a case report, what they will do? Again, the agency would themselves do it or they would outsource this activity to their service provider. Now, this is the service provider for the regulatory agency, not for these companies. Okay. Now, the service provider will do the literature monitoring. They will come across literature case reports, and then the European Medicines Agency will share these cases to all these companies. Now, what is the benefit here? All these companies don't need to do the literature monitoring, right? So only the agency would do it, and the agency would forward to all these companies, right? So efficient. And these are processed cases. You just need to import in your database. That's it. It becomes as easy as that, right? So this is the concept of medical literature monitoring, and this is for I think 200 products and done by the European Medicines Agency. Now it is the time for demo. I'll show you how literature monitoring is done. Okay, and I'll use Embase. Sorry, I will use PubMed because that is free of cost. So what should you do? You should first check pubmed.gov. So this is what you need to search. So now you got this. Now you can search for a product name. So I'll say take something like a remdesivir. So you can take any product and you click on search, and you get so many literature articles. And I'll tell you how many are these. These are 3008. Okay, and these are for all the years. Okay, and remdesivir there are so many literature articles. Now I have not used any search string. So what you can do is you can use the search string which I showed you, and you can click on and you can paste that search string and you will get all the information. Okay? So I'll not do that now, but then that is the way it can be done. Now assume that you have been selling this product only in the last 1 year. Okay, so in that case what you can do, you can have the publication date as 1 year, or else you can have additional filters where you can evaluate, and based on that you can decide. Okay, and also what kind of articles you want, or are you looking for case reports, right, safety studies and so on, and that to all which all languages, and are you talking about only humans or even animals, and which all journals, right? Also the age group of the patients, all that you can select. Apart from this, you can even create alerts. You can see here, create alerts. You can click on this, and ideally you can log in, okay, and then you can create the alerts. You can do that. So you need to log in, and then you can create alerts. So that way you will get automated alerts every week. You can decide the timeline that you want it every week or every 15 days, right? Or say every 3 days. So even that you can do. So based on that, you will get the information. So I'll just show you some more examples. Say I searched for literature case report. Okay, I'm not specifying the time frame, and you may get some information. For example, this is about COVID associated mucormycosis, or else so this one, let us look at the second one, which is remdesivir induced symmetrical drug related intertriginous and flexural exanthema, right? So this is a case report. I click on it. I'll just show you how it works. And thankfully there is a free full text also available. So you click on it. I'll just show you how it works. Yeah, so you now have the full text article. First of all, you need to look at the country where the article is from, so that you understand whether your product is sold in that country or not. For example, here it is in Germany. And assume that your product is sold in Germany. So yes, it is possible that it is your product. And assume that your product is being commercialized for the last 4 years. So this article was published in 2020. Okay? So it is obvious that it can be your product. Now you can get into the article and you have seen that there is no trade name mentioned here, right? So again, it can be your company product. Now you have the information about the age of the patient, gender, right? So you have one of the identifying criteria. Second is remdesivir itself. Then you also have the adverse event information, which is SDRIFE, right? So that is the adverse event. Now you have that also. And then finally author, who is a reporter, right? So you have author, the name, and also the email address and the address. You have all the information. So this is how you would undertake the literature review, right? So this is a valid case report. So like this you can do even for relevant safety articles. So you can do that as well. And again, you would identify them and then you would maintain a tracker, right? So generally you have at least 2 levels of review. That's somebody who undertakes the first level of review and then the second level of review, preferably by a physician. And then you can document all this. Okay? So this is the way the literature search is performed in a pharmaceutical company. Okay? So this is the entire literature review process. I hope you found this session to be interesting and useful. And what I'm also going to do is I'll share the search string with you in the comments below. I'll share that with you so that it will be useful for you, right? So you can look at the description section and you'll be able to get the search string. And then you can practice. You can put the product name and also you can search. So this is the way you can do it. And you can create alerts, right? And also for the time range, you can set the dates that this year to this year or this date to this date. You know the date when the product was approved and today's date. So all this. And then subsequently every week if you are doing the literature monitoring. So that also you can do. So apart from this, the literature monitoring can even be done for aggregate safety reports or the PSURs. So that's slightly different, but then again, it is done in a similar fashion where you use the same search strings and you'll get more information. Feel free to reach out to us if you have any questions, comments, or even suggestions. Okay? All the best. Take care. Thank you.